everyone. This is Chadi Alraies from New York AVS. I'm really privileged to be with Dr. Fabrizio Fanelli to talk about New York AVS, but also about the international presence and importance of education for endovascular therapy. Dr. Fanelli, thanks for being with us.
Oh, thank you. It's a great pleasure to be here. I think this year the meeting improved very well.
Mm-hmm.
There is a lot of discussion in all the sessions, also with young people, that I think is very important, for the future of endovascular procedures.
Absolutely. So we talked offline about the importance of education and about putting multidisciplinary approach to endovascular problems. So tell us about this a little bit.
Nowadays we know that we have to work in MDT fashion, because everyone can bring on the table his own experience or background. And then obviously the final goal is to give to the patient a best treatment modality.
Mm-hmm.
So if this is also what we do in our daily practice. We discuss each case, single case, with our colleagues to define is better endovascular treatment or a surgical one, or combine them.
Yeah.
So I think this is the goal, to improve our knowledge and also offer something better for the patients.
Absolutely. And you mentioned also, Dr. Fabrizio, you have your meetings. It's called I Am Endo, which is exactly talk about these discussions.
Absolutely. Yeah, we define this meeting now. Next year will be the third edition. It is the International Multidisciplinary Endovascular Forum, and it's based on the multidisciplinary discussion of different topics. So on the podium there is always a cardiologist, interventional cardiologist, vascular surgeons, interventional radiologists discussing the aorta, the peripheral arterial disease, and also AV fistulas for dialysis patients.
And these are all discussions. Basically, you put a case or a topic, and they say how you tackle this issue.
This is just based on a specific topic or on recorded cases.
Nice.
Just to give the idea what can be the treatment, the ideal treatment.
Yeah.
And we involve in discussion also the audience, so they can also have some questions and solve some doubts that are always a lot, especially for the endovascular procedures.
Absolutely. Well, I thank you so much, Dr. Fabrizio, for your time and also for being a pioneer in such a new venue and discussion way for conferences for spreading education.
Yeah, thank you to you.
Yeah. So thanks for watching us. This is Chadi Alraies coming to you from New York AVS, New York 2024. Dr. Fabrizio, thanks again.
Absolutely.
Appreciate it.
Pleasure.
Thank you.